There are about 40 million men in the US who are afflicted with an enlarged prostate and urinary difficulties. And Shane here is 59 and I'm 57. I know my stream is definitely not as strong as it was before. Shane has had this problem for about over a decade, and he's been struggling with this problem, and I'm going to have him share his journey with you regarding what he went through and his outcome. Shane, thank you so much for sharing your story.
You're welcome.
Okay, can you tell us what you went through and your journey regarding this enlarged prostate and urinary difficulties?
Well, I had a catheter for 2 days, which wasn't that.
Before the catheter, before you had...
Before I had the surgery, I couldn't even stand up at a commode and urinate because there was no pressure and I just went everywhere.
And for how long did you suffer with those symptoms?
For about 15 years.
So what made you decide, okay, after 15 years, now it's the time to have something evaluated and done?
I just had had enough. It was a point I'm like, I have to get something done.
15 years is a long time.
Yeah, well, I was getting to where sometimes at night I couldn't even go.
And were you having to get up at night a lot?
Yeah, like 5 times a night.
5 times a night?
Yeah.
How do you sleep?
In between.
I don't think your mind ever goes to the deep sleep that it needs if you get up 5 times a night.
Probably not.
Okay, so it sounds like you probably were feeling pretty tired the next day.
Yeah, I was always pretty tired.
And that you did that for over a decade.
Yeah.
Okay, so you finally came in here and sought some sort of evaluation and treatment. Tell us about that experience.
The experience was good. You told me you checked my prostate and said it was really enlarged.
And how was that done?
With the little scope.
A lot of people are very apprehensive about that little scope. Can you tell us about the experience of having that scope inspection?
It wasn't bad. It just made you feel like you had to go to the bathroom. Other than that, there was no problem.
Okay, after that scope, or also known as cystoscopy, you also had an ultrasound of the prostate, and we measured the size of your prostate.
Right, and that was very non-invasive.
Okay, very well tolerated, sounds like.
Yeah.
Okay, and we discovered that you had an enlarged prostate, which was the most likely cause of your urinary symptoms. What was done after that?
I had surgery done where they removed part of my prostate.
Do you remember the name of that surgery?
No.
TURP, TransUrethral Resection of the Prostate.
Okay.
Also known as roto.
Yeah, that's the one I was thinking of.
Yeah. And okay, so you had the roto done. And how long ago did you have that procedure done?
I had it done November 15th.
Okay, so several months ago, about 4 months ago.
Yeah.
Tell us about your recovery from that surgery.
Well, like I said, I had a catheter for 2 days, and then after that, then the only problem I had was my bladder spasms were kind of painful, and that happened for about 6 weeks.
So you're having some bladder spasms after the catheter came out, 2 days after the procedure. And did you have to stay in the hospital after surgery?
No.
Okay, that's fairly typical. All right, so 6 weeks of bladder spasm. Tell us about that. Tell us, I know a lot of people see all these videos, think, oh, everything works out great. But I want people to hear from the actual experience of the people who are actually going through it, who went through it. Bladder spasms, can you elaborate a little bit more about that?
Well, it just feels like you got to go to the bathroom really, really bad, but you can't.
So urgency of urination, we call that urgency, when you feel the need to go and then you have to rush there and sometimes you can't go.
Right, but that lasted about 6 weeks, and then after that, for that 6 weeks and for about another 2 to 3 weeks, when I had to go, I had to go. I hadn't.
Okay, that's the urgency.
Yeah, I couldn't stop. But now I can stand up. I can urinate in a toilet. I get a full stream. I have pressure like I had when I was young, and it's just if I had to do it again, I would have done it 15 years ago.
And that is not uncommon. I hear that very frequently from patients who have undergone the surgery. They wish they had done it sooner.
Yeah, I do.
And now, how many times are you getting up at night now? Because before the surgery, you were getting up 5 times a night.
Well, I get up about one time a night now, but that's really habit. I've always woke up at 3 o'clock, so I just get up and go while I'm awake.
Sounds like some of that may be habit.
Yeah, it's just because I don't really have the urge to go even when I wake up, but I just get up and go anyway.
Sounds good. All right. And you already said that if you had known how well this was going to work, you would have had it done 15 years ago. How else has this surgery changed your quality of life?
Well, it's completely made where I can go to restaurants and do what I want to do because I can urinate when I need to. And it's not like I feel like I need to, then I can't. And like that, it's when I go, and I'm done.
It sounds like you are having more control over your urination and not having the need to urinate control your life.
Absolutely. Absolutely. Because now I can hold it for however long I need to, just like normal, like when I was young. And then I can go completely empty my bladder, and then I don't need to go again for a long time.
Sounds like a good outcome to me.
Yep.
All right. Well, thank you, Shane, for sharing your story.
You're welcome.
May I share this video with those who may be interested?
Yes, I think any men that go through this should take this. Don't put it off. Take it and get it done. You'll be much happier.
Thank you so much, Shane.
You're welcome.